is time to chat about the feet. When it comes to injuries on the pickleball court, almost everybody can relate to something around the foot and the ankle. Plantar fascia discomfort on the bottom of your foot, your classic ankle sprain where we just roll that ankle, Achilles tendinitis or Achilles tendinopathy. By the way, what the heck are those things? Or your typical calf strain. During this video today, I'm gonna go over what these common injuries are, as well as some things that we can try and do to minimize these risks moving forward. Before I get started, there's two main topics I need to discuss. One of them is workload. If we're playing way too much and don't give the foot and ankle time to recover, it might lead to pain and discomfort, as well as our proper gear. As you can see here, I'm holding a Selkirk Court Strike Pro shoe that offers lateral support side to side, extra grip on the bottom of the shoe, as well as just overall durability, so I don't have to switch my shoes out every other week. First up, your plantar heel pain or plantar fasciitis. What is this? On the bottom of the foot, we have a very dense fibrous band of connective tissue called the plantar fascia. The plantar fascia runs from the base of the heel all the way up into our toes and provides what we consider our arch support. You typically hear the phrase plantar fasciitis. The itis means inflammation, so we're assuming that there is inflammation of our plantar fascia that is driving our pain. Recent evidence actually contradicts this and shows that inflammation is not always the driver of our pain. That rest, ice, anti-inflammatories is not the first line of defense when it comes to plantar fasciitis. There's been a recent shift to plantar heel pain instead of plantar fasciitis in order to promote individuals taking an active approach to their recovery in order to calm down symptoms while building load tolerance to the bottom of the foot to better tolerate our active activities. Here are some of my favorite movements to try and reduce the discomfort along the bottom of the foot while also building back that load tolerance like I mentioned. The first exercise I'm gonna do is called a towel crunch. In this exercise, I'm gonna try and pull a towel or sock or imaginary sheet from my toes towards my heel, and I should feel a little bit of activity on the bottom of the foot. This is an excellent one to use early on in someone dealing with plantar heel pain as we're getting some activity along the bottom of the foot, but generally it's very comfortable. One of the other big things that I recommend to folks dealing with this type of symptoms is doing things in the morning to try and calm symptoms down before we take those first steps, as these are often very uncomfortable. So on the edge of the bed, I might have somebody try doing some sort of light calf raise variation just to get some activity and blood flow throughout the back of the lower leg and bottom of the foot. And what I call a plantar fascia stretch, where I'm gonna hold down the heel, come over the top of my big toe and other toes to try and get a comfortable stretch throughout my plantar fascia. Now, activities like pickleball require a lot of load placed through the bottom of the foot along your plantar fascia, so we need to transition to some standing exercises as soon as they are comfortable. So here is one that is unique to plantar heel pain that I almost always recommend to folks that truly have symptoms that present like plantar heel pain. For this movement, I'm gonna roll up a towel, or in this case, a sock, and place it underneath my big toe. And then I'm going to perform some sort of heel raise. In this situation, I will still do it on double leg, but the towel or sock is meant to provide an extra stretch by promoting some extra extension throughout your big toe and stretch along the plantar fascia. If we can do 10 to 15 double leg exercises comfortably, I immediately try and transition into single leg options, once again trying to complete 10 to 15 while keeping symptoms very manageable. All right, next up is the common ankle sprain. The most common ligament irritated in this case is the anterior talofibular ligament that provides support along the outside of our ankle. How many of you guys have heard the term RICE, rest, ice, compression, elevation, and have used that as the first line of defense when it comes to an ankle sprain? I have too. But this is a little bit outdated, and there's once again more active approaches that we can utilize to try and get back onto a court safely, quickly, and effectively. We have two main goals early on, and that is to manage swelling and restore your range of motion. So if you are dealing with a lot of swelling, there's a couple options we can utilize. Yes, Rest, compression, and elevation can be beneficial, but we can also do some things to try and act as your own muscle pump to get some of the fluid out of the ankle and back up into the bloodstream and system. Next on the list is range of motion. Here are two of my favorites when it comes to getting your ankle moving and trying to restore that range of motion. The first is your simple ankle alphabet. So I'm gonna try and run through the entire alphabet. Next exercise that I'm gonna run through when it comes to restoring range of motion is a simple dorsiflexion stretch. So in this situation, I've got my foot and ankle on the ground and I've got my weight placed through my front knee, and I'm just going to rock forward until I feel a gentle stretch. Now I mentioned two different phrases, Achilles tendinitis and Achilles tendinopathy. So what's the difference and why are they managed a little differently? Well, Achilles tendinitis is once again that itis or inflammation of that Achilles tendon, and it's generally a little bit more acute, meaning it's not lasted for an extended amount of time. When we transition into an Achilles tendinopathy, usually the symptoms have persisted for months, and then the tissue is not just inflamed, but there's actually weakening that can take place. The Achilles tendon can now become deconditioned, which leads to a little bit more stingy rehab to try and also manage pain, but build up the capacity of that tendon to be able to tolerate cord activities so we don't just fall into this vicious cycle of rest, activity, pain. When we can transition to standing exercises for the Achilles tendinitis and Achilles tendinopathy, I usually like to start out on 2 feet, whether that be with a static hold for up to 20 to 30 seconds or just repetitive, one after the other for 10 to 15 reps. As soon as we can transition onto a single leg with once again a static hold, I love to do so. And then I transition right into repetitions. Now I don't just stop here. You can play around with different things such as doing the calf raises off a step to provide an increase in stretch to your calf and Achilles when it's able to tolerate that, or also hold some sort of weight or use a barbell to try and increase the load through the calf and the Achilles, knowing that these forces on a pickleball court are very high. Each one of these injuries that I've discussed in this video generally doesn't stop with just your strength exercises. Pickleball, there's a lot of running front to back from the baseline to the kitchen, a lot of side to side movement that requires a lot of ask and a lot of demand from our foot and ankle. So usually I like to implement some sort of plyometric exercise when somebody can handle it, whether that be for that plantar fascia or plantar heel pain, whether that be for your ankle sprain or your Achilles tendinitis or Achilles tendinopathy. So starting on 2 feet, usually we can just go up and down. We can go front to back. We can switch it up and go side to side. There's many different options. I can move side to side on 2 feet. I can also move front to back. Similar to the calf raise variations, as soon as we can get onto one leg, I would like to do so. Be comprehensive with your rehab, and if you need help navigating some of these things, please do not hesitate to reach out to your provider or shoot me a direct message. Hit that like and subscribe button below in order to get this information out to more people. And then follow me on other socials like Instagram and Facebook, where I generally put out a lot more frequent tips to try and stay healthy on the court. Thanks for watching, guys.